to discuss about the anatomy of the shoulder joint. Shoulder joint is a synovial joint and its variety is ball and socket. Articular surfaces in this diagram you can see this is scapula, this is humerus. The articular surfaces are medially, this is glenoid cavity of the scapula, and here is head of the humerus. You can see here and compare the size, both articular surfaces size, this size and this size. This head is comparatively 4 times larger than this glenoid cavity. This is the reason why this joint is structurally very weak and functionally it is highly mobile. It provides highly mobility and it is structurally weak. So these are the two articular surfaces, medially glenoid cavity and laterally head of humerus. If you see the glenoid cavity from here, this is glenoid cavity. This is glenoid cavity. Here is tubercle. This is supraglenoid tubercle. Here is a tubercle. This is supraglenoid tubercle. Just above the glenoid cavity, this is supraglenoid tubercle. And this tubercle gives attachment to long head of the biceps. Here long head of the biceps attached. This is long head of the biceps, brachii. This long head of biceps brachii passes through bicipital groove. So this is long head of biceps which is attached with supraglenoid tubercle. This is supraglenoid tubercle. Another thing, at the margin of this glenoid cavity, glenoid labrum is attached. This is a fibrocartilaginous rib. This is glenoid labrum. This is attached. And this glenoid labrum deepens this cavity. It is attached here. This is lateral view, this is anterior view. So it is attached towards the margin. It deepens the glenoid cavity. This is glenoid labrum, fibrocartilaginous rib. Now, capsule of the joint. Capsule attached medially to the margin of glenoid labrum. This is margin of glenoid labrum. It attached with the glenoid labrum, margin of glenoid labrum. Here in this diagram, you can see here is capsule. Inferiorly it is laxed and this capsule is attached with this glenoid labrum. And here is long head of the biceps which is attached with this supraglenoid tubercle. So this is capsule medially attached with glenoid labrum and laterally attached with anatomical neck. This is anatomical neck. It is attached with anatomical neck and inferiorly it extends up to surgical neck like this. Here it becomes lax. So this is joint capsule. This is joint capsule. And this capsule has an opening at superolateral part. This is superolateral part. This is opening which provides passage for long head of biceps brachialis. So it provides passage for long head of the biceps brachialis. This is an opening. Anteriorly, here is also another opening. Anteriorly, here, it has an opening. And this joint capsule is internally lined by, internally it is lined by synovial membrane. This is synovial membrane. This synovial membrane form a tubular sheath around this long head of the biceps, and it extends up to some extent here. It forms a tubular sheath around the long head of the biceps, and also it communicates with a bursa. Here is a bursa known as subscapular bursa. Here subscapularis muscle is attached. This is subscapularis muscle, and it attached with this lesser tubercle. And here this portion, here bursa is present. So it communicates with this bursa. This is subscapular muscle attached here, and deep to subscapular there is subscapular bursa. So position of the bursa is here, and through this opening, this synovial cavity communicates with subscapular bursa. Now, this capsule is anteriorly reinforced by 3 ligaments. Here is one ligament, that is glenohumeral ligament. Here is glenohumeral ligament. Glenohumeral ligament. So it is superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. Glenohumeral means between glenoid cavity and humerus. This is a glenohumeral ligament. Superior, middle, and inferior. So by these 3 ligaments, it becomes strung anteriorly. And it is also surrounded by a cuff-like structure, that is a rotator cuff or musculotendinous cuff, which cuff is formed by tendons of 4 muscles. Anteriorly, this muscle cross this joint, so flattened tendon of this muscle, this is subscapularis muscle. And posteriorly, so if you make this muscle, which is lies anterior to this, so this muscle is this. Here is this muscle. This is subscapular muscle. Deep to subscapular muscle, there is subscapular bursa. And here is muscle which lying behind on the posterior aspect of the scapula, which attached with greater tubercle from above downward. These muscles are supraspinatus, infraspinatus, and teres minor. So these muscles, tendon of these muscles become flattened and joined with each other by fibrous connective tissue. So this system around this joint form musculotendinous cuff. It is also known as rotator's cuff. So this arrangement, this musculotendinous cuff, support the shoulder joint from anterior aspect, from superior aspect, from posterior aspect, but inferiorly there is no any arrangement for the support. So inferiorly this joint is very weak. Another structure, another mechanism which gives support to this, here is acromial process. This is acromial process. This is acromial process, and here is coracoid process. In between these two processes, there is coracoacromial ligament. Here is coracoacromial ligament. And here one muscle is attached. This muscle is posterior fiber of deltoid. Anteriorly, here is anterior fiber of the deltoid. And a muscle attached with this that is short head of the biceps and coracobrachialis. So these structures form the secondary socket. This is secondary socket. This structure reinforce the joint from anterior aspect, from superior aspect, from posterior aspect. So it provides stability from anterior, superior and posterior aspect. Inferiorly again, there is no structure. So inferiorly, this joint is very big, and this is the reason why dislocation of shoulder joint is infraglenoid dislocation or subglenoid dislocation. This is glenoid cavity. This dislocate toward the inferior side. After reaching below this, it again may ascend upward anteriorly or posteriorly. But initial dislocation is infraglenoid dislocation. So this is the arrangement of the shoulder joint and its structure. Inferiorly, it's another structure which lie in relation in full abduction position. Here is one muscle, that is long head of triceps. This long head of triceps supports this joint from inferior aspect when this is fully abducted. In full abduction position, it reaches inferior side and it supports from inferior aspect. And in relation to this, here is axillary nerve and posterior circumflex humeral artery. In case of dislocation, initial dislocation is infraglenoid, so these two structures may damage during dislocation. And axillary nerve, as you know, it gives supply to deltoid muscle and teres minor. And deltoid muscle causes abduction at shoulder joint between 15 to 90 degrees. And from 0 to 15, supraspinatus, 15 to 90, deltoid. So abduction between 15 to 90 degree become affected due to injury of the axillary nerve. So this is about the shoulder joint. Now movements at this shoulder joint. This is position you are seeing from above. Here is position of green white cavity. Direction of the green white cavity is anterolaterally, not exactly laterally. So adduction and abduction takes place in this direction, anterolateral side. This is abduction, this is adduction. And flexion and extension takes place at right angle to this. Flexion, extension, adduction, abduction. And also circumduction is combination of all movement. These movements occur at the shoulder joint. Rotation, medial rotation and lateral. You flex the elbow like this and now do this and then do like this. This position is, in this position there is medial rotation and in this position there is lateral rotation. So medial and lateral rotation also takes place at this shoulder joint.